Hello, I'm Dr. Sandra. I'll be taking a class on the epidemiology of dengue fever and its clinical management. So, dengue it ranks as the most important mosquito-borne viral disease in the world because over the last 5 decades, it has emerged globally as a critical threat to population health. So it's a major public health concern, especially in the tropical and subtropical regions of the world. When you see the global scenario, 2/5 of the world's population is at risk for dengue. There are about 50 to 100 million dengue infections every year, 24,000 deaths in a year. So this dengue not only leads to morbidity and mortality, it also leads to disability adjusted life years. So productive life of an individual is also reduced by this infection, and it's endemic in more than about 110 countries. %75 of the current global burden due to dengue are in Asia and Pacific region, especially the Southeast Asian region, which includes 10 countries including India. So they are endemic. So when do you say a country is endemic, when do you say a country is epidemic, when do you say there is hyperendemic. Hyperendemic is said to be when there is detection of all 4 serotypes of the disease. Okay. So you can see the diagram in this picture, the countries where the dengue has been reported. Okay, you can see that India is also colored in orange color. So India belongs to the Southeast Asian region. So in Southeast Asian region, again they are classified into category A, B and C. Category A, it's hyperendemic. Hyperendemic means I told you all 4 serotypes are seen. So it includes Bangladesh, India, Indonesia, Maldives, Myanmar, Sri Lanka, Thailand and Timor-Leste. So what you need to understand is these countries are at risk for being endemic to dengue. So if you are visiting these countries, you should be careful, wary. Okay. And Bhutan and Nepal comes under category B and Korea under category C. So in the year 2012, around 0.29 million cases were seen in CR. And in Western Pacific region, around 0.3 million cases. Now this is about the global scenario. It's in the Southeast Asian region as well as the Western Pacific region. And other region countries coming under it, 3 categories A, B and C. Okay, what do you mean by hyperendemic, endemic and epidemic? Okay, then the national scenario, coming to the country India. The first isolated in 1945. The first recorded evidence of dengue fever was in 1956 in the Vellore, Tamil Nadu. The first dengue epidemic of our country was reported in Calcutta in 1963. After the incidents in 1996 at Delhi, it became all over India. Okay, after that incident, after in Delhi, the occurrence of the epidemic in Delhi spread all over India. There's so many states. Okay. So the recurring outbreaks can be seen in around 36 states and union territories. So you can see this picture. Almost all the states and districts and union territories are affected by this disease, sparing a few in the northern region. So these are statistics of the year 2007 to 2016. You can see the number of cases rising as each year passes by, as well as the number of deaths also. So there was a peak in the year 2012 and 2013. So around the year 2016, the number of cases increased. The epidemic rise first took in this chart, showing the dengue cases year-wise. Then there's an increase in the year 2012-2013. Then again it decreased in 2014. Again it rose around the year 2016. So you can again see the similar number of deaths per year. And there's an increase in 2012. Then it decreased to 14. Again it increased by the year 2015-16. So the seasonal trends. So dengue increases. It increases during the monsoon period. So in the June, July, August period it increases, and then there's a peak after that, and then it decreases. Coming to our state, the scenario in Kerala. It's a major public health concern, as you all know. It is first reported in Kottayam in 1997, and it is in epidemic proportions in the year 2003. It's endemic in all 14 districts. Yeah. So the peak incidence during is seen similarly in the months of June to July. So here this is a district-wise dengue cases. Okay. So the maximum number of cases in Trivandrum, followed by Kollam and Pathanamthitta, and Alappuzha also. Okay. So it's Trivandrum, Kollam and Alappuzha. So dengue cases year-wise in Kerala. So I told you there was an epidemic in 2013, came down, again it keeps on rising. So from 2012 to 2016, maximum number of cases was seen as evidently by the orange color in this graph, chart 2. It's in 2013. Then look at this table. It shows the dengue cases month-wise. So I told you it's again more in the months of June, July, August. It's clearly seen in this table. Okay. Are you able to appreciate it? See the number of cases in June, July, August. So much more than the others. Again, it's clearly evident in this chart. The case fatality rate is more in the year 2015 in case of Kerala. Now coming to the epidemiological determinants. So dengue is a dengue virus. It's an RNA virus of family Flaviviridae. And the major vectors of disease are the Aedes aegypti and Aedes albopictus. So they are daytime feeders. So talking about Aedes mosquitoes are also known as tiger mosquitoes. Can you see the diagram? You can see the white stripes. Clearly make out Aedes mosquitoes from other ones. White stripes in the black body. Okay. So this tiger mosquitoes. So Aedes aegypti is a nervous feeder, and it's an anthropophilic. What do you mean by anthropophilic? They prefer humans for their blood meal, and they are discordant species. That means they need more than one person to complete their blood meal. So you bite one person, then one bite person. They take little from each person. So the number of, if in a cluster formation is more in case of Aedes aegypti compared to Aedes albopictus. Aedes albopictus is more of an aggressive feeder. So in one blood meal itself, they complete their quota, and they need only one person to complete their blood meal. So they're not a discordant species like Aedes aegypti. And you can see this is the picture of the eggs laid down by the Aedes mosquitoes. Okay, They are singly laid and they are cigar shaped. This is a cycle, Aedes mosquito, life cycle. So first start with the eggs. Eggs have been laid in water or whatever the suitable atmosphere, environment they need. Then one day they develop into larva. This is the larva. It is suspended from the water surface, okay, at an angle to the surface of water. So then they become pupa, the inactive phase. Then they develop an Aedes mosquito, adult male, female. Then after, this is the Aedes mosquito with taken a blood meal. You can see the blood. Okay. So there are different types of containers. So artificial containers, household homemade containers, dirty containers, other places. This Aedes mosquitoes prefer to lay the eggs. You can see it in coconut husk, rubber tires, plastic bottles, plastic cups. Okay, pots, broken pots and all, in tree holes. So the preferred places for egg laying is Aedes object, Aedes mosquitoes. Okay, so the host it affects all the ages and both sexes. Okay, so 16-30 degrees Celsius is the favorite climatic conditions and humidity of 60 to 80%. So this is the transmission cycle. Can you see the transmission cycle? Yeah. This is a wild, beginning from the topmost. It's a wild Aedes aegypti mosquito. It bites a dengue infected person. Then the virus gets loaded in its gut. Then it ingests the blood, the dengue, and along with the dengue virus. So it takes around 10-12 days for the dengue virus to incubate. So after that period, then they bite another person. So whenever they bite, they inculcate this virus particles into them, and the person also develops dengue around 4 to 13 days later. In this way, I told you in Aedes aegypti, and it's a nervous feeder, so it needs more than does both male and female take blood meal? No, only females need blood meal. So males, they survive on plant juices. The females, in order for reproduction, for completing the gonotrophic cycle, they need a blood meal. So they'll take blood meal from several people, leading to cluster formation. More likely in the case of Aedes aegypti. Okay. Central University learning medicine. So what are the clinical manifestations? I just run through this. Okay. Everyone doesn't have to develop symptoms. It can be asymptomatic or symptomatic. So symptomatic can be appreciated as undifferentiated fever, the viral syndrome, or dengue fever, dengue hemorrhagic fever, or expanded dengue syndrome. So this is an expanded dengue syndrome or isolated agonopathy is an unusual manifestation. You usually see dengue fever and dengue hemorrhagic fever. So dengue fever again can be seen without hemorrhage and with unusual hemorrhage. And dengue hemorrhagic fever without shock and with shock. It is dengue shock syndrome. So these are different manifestations of the dengue virus infection. You can also get this infection and be asymptomatic too. Okay, you have to remember that. So what are the features of the classical dengue fever? Here the incubation period is around 3 to 14 days. It's a sudden onset, high grade fever, intense headache, muscle and joint pains, retroorbital pain. Patient feels pain behind his eyes and all. He can also develop photophobia. And rashes can be seen around 3 to 4 days later. The other systemic symptoms like extreme weakness, anorexia, constipation, altered taste sensation, all can be experienced in the case of a dengue fever. So a pictorial representation of the symptoms: fever, rash, back pain, eye pain, headache, muscle ache, joint pain. Okay. So fever is high grade, comes around 39 to 40 degrees centigrade. It has a biphasic skin eruptions can occur during remission or the second febrile phase. Flushing, mottling, or fleeting pinpoint eruptions on the face, neck, and chest. So it's a conspicuous rash, can be maculopapular or scalatiform on third or fourth day. So the fever there lasts about 5 days only. So the natural cause of the dengue infection is mainly of 3 phases: febrile phase, critical phase, and recovery phase. So febrile phase, I told you the fever lasts about 5 days, and the fever, they can develop rashes, and they develop a lot of systemic symptoms. I just mentioned to you all this. Critical phase, there's chance for the person to develop a hemorrhagic fever or go into shock. Okay, so the things that come that play a huge role in its determination is the thrombocyte count as well as the hematocrit value. The rising hematocrit value as well as a moderate to marked thrombocytopenia. These are the 2 clinical laboratory changes that are distinctive and constant findings in case of a dengue patient. Okay. Then in the critical phase, the temperature might decrease, and if there is an increase in the capillary permeability, then that marks the beginning of the critical phase. So this period of clinically significant plasma leakage usually lasts 24 to 48 hours only. So 1 to 2 days only this critical phase will last. So here the main thing is the capillary permeability and the plasma leakage. Okay, the person can go into shock or the person can go into recovery phase. So if the patient enters the recovery phase after surviving 24-48 hours, there will be a gradual reabsorption of all the volume fluid that is being collected. Okay, then the general well-being improves, the appetite returns, and all the symptoms start abating, and the patient recovers and stabilizes. That usually occurs in the recovery phase. So critical phase is the phase when the patient can go into shock, or if he survives the 24-48 hours, he can go into the recovery phase. So what are the warning symptoms that can occur precede this plasma leakage, precedes the shock that person can have? That can be abdominal pain or tenderness, persistent vomiting, and lethargy, clinical fluid accumulation. If you take an X-ray, you can see the fluid in it, and there can be mucosal bleeding, liver enlargement, oliguria. This kind of all should be taken as the warning signs. The patient can develop shock in a few minutes. Okay. So the warning signs also include palpitation, breathlessness also, because I told you you see the X-ray, you can see the fluid accumulation in it. Then cold, clammy extremities, narrow pulse pressure, rapid pulse, hypertension, all are warning signs of the patient going into shock. So what are the high risk groups? So all the vulnerable population which you already know: the pregnant ladies, infants, elderly, the obese, people with peptic ulcer diseases, G6PD deficiency, thalassemia, coronary artery diseases, and chronic diseases like diabetes, COPD, bronchial asthma, hypertension. Patients on steroid, antiplatelets, HIV infected patients are all high risk groups. So they are greater chance to going to developing complications. So lab diagnosis, there is virus isolation. Specimen can be collected, face serum, plasma, autopsy tissue, the mosquito collected from the affected areas. Okay, virus isolation usually is done in the first 6 days of the illness. Then there is RT-PCR, detecting the viral nucleic acid. And there is NS1 antigen ELISA, NS1 antigen rapid test also. Here detecting the viral antigen in it. Okay. First you're isolating the virus, then you're looking for the virus nucleic acid, then you're looking for the viral antigen. So this antigen detection test, it's a tool for detecting the acute dengue infection. Then there are other tests, serological tests like MAC ELISA, IgG ELISA, human immunoassay. Okay. So these are different. This is the table showing different tests. Okay, and the time taken for the results to come. So and see this when the test become positive. So day 0 refers to the start of the symptoms. First refers to those in primary infection, and second refers to those in with secondary infection. See, when the disease starts and viremia can be seen, the viral load is increasing. So that can be detected by the NS1. Okay, but then the IgG you can only detect from day 4 to day 5. The initial days you need NS1 to detect the infection. So acute infection can be detected by NS1 antigen detection. Okay, IgG you can use mostly from day 4. So how do you define a suspected case? So any acute febrile illness of 2 to 7 days duration with 2 or more of the following, which are the other symptoms that you look for: headache, retroorbital pain, myalgia, arthralgia, rash, hemorrhagic manifestations, and leukopenia. What is the case of a probable diagnosis? So again, acute febrile illness of 2 to 7 days duration with 2 or more of the following. Same symptoms: headache, retroorbital pain, myalgia, arthralgia, rash, leukopenia, thrombocytopenia, and at least one of the following. So there is either positive in IgM antibody test, occurs in the same location time as confirmed case of the dengue fever, or separative serology on single serum sample. Okay. So at least one of the following of these things as well as the symptoms is needed for the probable diagnosis. So confirmed diagnosis is a probable case with at least one of the following. So isolation of dengue virus from serum, CSF or autopsy samples. Autopsy samples. A fourfold increase or great increase of serum IgG or IgM antibody. Detection of a virus or antigen in tissue, serum or CSF. Detection of dengue virus genomic sequence by RT-PCR. Okay. So you can use IgG, viral antigen, or the RT-PCR, or from the autopsy samples. So these things are in addition to the probable diagnosis definition. Okay. So how do you classify a person with dengue hemorrhagic fever? So it's either a probable or confirmed case with hemorrhagic manifestations shown by any of the following: positive tourniquet test, petechiae, ecchymosis, or purpura, bleeding from mucosa, GI tract, injection sites, or any other location, plus thrombocytopenia, plus evidence of plasma leakage due to increased vascular permeability. So there is either a rise in average hematocrit for age and sex, or more than 20% drop in hematocrit, so there is evidence of plasma leakage in the form of pleural effusion, ascites, or hyperproteinemia. Okay, that is definition of a dengue hemorrhagic fever. So it's a probable confirmed case, and I already mentioned to you, with hemorrhagic manifestations. So these are seen, and these are lab evidences. Okay, then symptoms as well as lab evidences both together can define a dengue hemorrhagic fever patient. Then coming to the dengue shock syndrome. So the criteria for dengue hemorrhagic fever with signs of shock including tachycardia, cool extremities, delayed capillary fill, weak pulse, lethargy or restlessness. Okay, so whatever is the criteria I told for dengue hemorrhagic fever, that plus the signs of shock. Okay, so the pulse pressure will be 20 millimeters of mercury with increased diastolic pressure, this around 100 to 80 millimeters mercury. Hypertension by age defined as systolic pressure less than 80 millimeters of mercury for those aged less than 5 years, or 80 to 90 millimeters mercury for older children and adults. Okay. And only then the expanded dengue syndrome, that is a not seen commonly, it's an unusual manifestation, but it's isolated organopathy. Okay, so it can involve CNS system or GI system, renal, cardiac, respiratory, eye. So what are the typical manifestations of dengue? Encephalopathy, encephalitis, febrile seizures, acute hepatitis, cholecystitis, acute pancreatitis, acute renal failure, hemolytic uremic syndrome, acute tubular necrosis, cardiac arrhythmia, cardiomyopathy, pulmonary edema, ARDS, etc. are the unusual manifestations of the expanded dengue syndrome. Okay, so this is a pictorial diagram showing all this manifestation. What is a viral infection can be asymptomatic, what is mild? It's mild, can be undifferentiated dengue fever, fever without complication or without evidence of capillary leakage. You can manage it. It's a moderate dengue. It is either dengue fever with high risk and comorbid situation, dengue fever with various symptoms and signs. So what are they coming in the vulnerable population, high risk population, and need a close monitoring as well as a possible hospitalization for such patients. Then there is dengue fever, dengue hemorrhagic fever with significant hemorrhage, shock, severe organ involvement. I told is expanded dengue syndrome. Then there is severe metabolic disorder. So this definitely warrants tertiary level care. So manage dengue fever. Dengue fever is symptomatic and it's the undifferentiated. It's a mild type. Then you don't need to be hospitalized. You need medicines from hospital, but you can take rest home with prescribing antibiotics, aspirin, NSAIDs should be avoided. And main focus is on the oral fluid and electrolyte therapy. Okay, you can use home-based fluids also for increasing fluid intake.